your older kids who's vaccinated, they have to have it.
My son Harrison got the word that he was quarantined last Thursday. He has shown no symptoms though, and is doing just fine. So he should be able to come back to school tomorrow.
Okay, so even though you're vaccinated,
So what they've done is, Ms. Harding said it was just, and it would be impossible for them to be able to try and have a tracking system, where these kids are vaccinated or not. So they had them produce a card to the nurse at school, and they basically.
Gene, how do we feel about them bringing in signs?
And signs?
Yeah.
Poster board signs.
That's fine.
As long as they're not blocking or hitting somebody else.
Hey,
Yes.
It
Yeah.
could be used as a weapon.
Yes, sir.
Shield. I'll take a
hey, Matt, how you doing?
Mr. Coach, you.
Oh,
I
yeah.
saw some on Facebook that some people had made.
You have a good day. I'm sick. Not sick, sick, just.
I honestly,
Super tired.
I did have a good day. I had scores of people that reached out to me. They all support. It was really, really nice actually. So.
How you, Miss Page,
I'm
Miss
okay.
Jackson?
Good.
Oh, y'all okay, Miss Allen? Well.
Good. I dropped my telephone in the swimming
You can get it on them.
That's right. Oh, I've seen,
Ms. Graham, can you hear me now?
seen those out there. By themselves too. Living with them.
You know, I guess it's been, God, probably 7, 8 years. They won right across from the office was stayed up. I don't know, all day long one day. Everybody went by and stopped and looked. It was a pretty good sized bear.
Okay, yes, you again.
Okay.
You're good.
It's delayed.
Okay.
I did. Sure enough, I did tell you this up there.
Won't take long to get them.
No. No.
Hey, Philip.
How you doing?
I'm doing fine. How about you? Hey, Phil.
Everything all around. There you go. Mr. Baker, sir.
We do have new chairs work.
I didn't notice that.
Wearing them out.
I hate these.
It's this week.
Small, look, I'll hold on.
Excuse me, I'm sorry.
I'll get my seat up where-
Hold on.
Mine was up Judy. Mine was hitting the table when I came in. I had to let it down.
You doing okay, too?
Good, gentlemen. Hope you all are.
My fault, Ms. Allen.
Thank you.
Hey, I'm good.
Still haven't had the guy come to the system. We're getting there.
Got gone up since about watching.
Ms. Gibbs just arrived, so.
Yeah, here, we'll have to go through.
Yeah, you may go to the back door and walk across. Yeah, all right. That's where we'll go. So you go now? I just. Yeah, she's going after her car.
Got to read it out loud.
I know. I forgot, but I do remember that now.
So I'll do my presentation. Recommendation, which is that. And then I think.
Motion and second for discussion.
You ready, Dave?
You ready?
Yeah, I don't see any issue. We got everybody.
Go for it.
27.
27.
I mean, are you okay?
You want to get them up to it, Rick?
Which way is it going?
You want to do it? You want
No, there's no way. Let's wait till we get these people.
Wait a minute. Just take it. Tell them this pressure's not deserved.
27's coming.
I'm sure they would be. Yeah, I'll read it. And I'll turn it over to you.
These outlets have been here.
First one that comes. Well,
So we are allowed to have a speak.
And
No,
discuss.
there's no public comment today because it's an emergency call. So once you sign in, you can go in and have a seat in one of those blue chairs.
Yeah, 'cause regardless of whether you do it. Regardless of whether you do it.
yeah.
And we're just having a seat in the blue chair.
Come up front. I'd be glad to come up front.
Nope, Stevie won't have a message, but I did. Thanks,
Phone out, make sure you can't.
Well, I'm gonna watch this.
Yeah, big is come on.
What? No. Are you?
No. Mom, no, mom, 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 mom. See, no, mom. Mama, 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 and now.
It's quiet as you've ever been.
Mama. Mom. No. 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 What time?
It's sharpening our signal going out. Yep. 160 people watching last I looked.
Mom. 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 Titi. Mama.
$180 now.
Ready?
September 7th, special meeting to order.
Thank you, Mr. Chair. We'll rise and do the pledge of allegiance, please. I pledge allegiance to the flag
of the United States of America, and to the republic which stands one nation under God, indivisible, with liberty and justice for all.
Thank you, Mr. Chair. First thing I want to do is welcome everybody in attendance. Appreciate y'all being here tonight, and definitely welcome everybody online who is watching. This is an emergency meeting called to address COVID-19 issues in our schools, and definitely appreciate you being here to be with us. Do remind folks, this is an emergency meeting. There's no other business, no public input. We did have public input on August 2nd and 9th, and we'll have it again at our regular monthly meetings like we always do. We do ask you to recognize the rules of decorum for public meetings. We appreciate that. I want to take a moment to say that our Board of Education lives in our community, cares about our students, and works hard to make the best decisions they can for our students and schools. Leadership and governance has been a big reason Polk County Schools has been so successful over the years. Our board members are not medical professionals, and a strong argument can be made that local boards of education should never have been put in the position of making health decisions during a pandemic. We know that there are strong feelings around COVID and how it's handled, but at the end of the day, I want everyone to keep in mind we're all working to make the best decisions possible given the circumstances. And we may disagree on what those decisions should be, but our goal is still the same, and that is to keep our schools open and to keep our kids in school. All right, Mr. Sherman, if you'll throw the presentation up there, please. The reason for the calling of the emergency meeting is due to the COVID impacts we have seen over the first 2 weeks of school. I want to point out that currently there is significant community spread here in Polk County, 19.2% positivity rate last week. I think that's the highest we've ever seen in Polk County. And we are experiencing about 6 to 8 positive exposures today in our schools. And that requires investigation and quarantining per the current guidelines. Since 8/23, we've had 90 positives. I think we just added another one a minute ago, and over 550 students quarantined. There are staff positives. Our staff are being quarantined for exposures, and they also have kids who have been quarantined, which puts a tremendous burden on us from a staffing perspective. I will say that this is a different animal than we dealt with last year. We deal with it every day and it appears more contagious, appears to spread more quickly, and it's affecting younger adults and kids at higher rates than we saw last year. It is impacting us even more with less restrictive guidelines than we had last year in terms of quarantining. So we're seeing a bigger impact on our staffing and our student quarantines. Third bullet. Third bullet. Yeah.
You mentioned.
Did I mention that?
Nope.
Oh, I do. Yeah, I do need to go back to the third bullet. I got it in here, Dave. I'm sorry. Thank you. Yeah, I do think that on August 2nd, we felt like we had turned the corner and we thought things were getting better. I don't think any of us anticipated the pace and frequency with which COVID would hit us as we started the year this year. We do notice that the majority of those positives are coming from the outside. These are students or families who've had COVID outside of school, and so they come into the school. Sometimes there are parents that will call us and tell us their child is tested positive, so those are outside. But we also have evidence now of internal spread with clusters. We'll have 2 clusters at Polk Central Elementary School. That means 5 or more students in a class are positive for COVID. And we will likely see some clusters considered at the middle school and the high school as well, with those epidemiological connections being made. We have seen large positive case impacts at Polk Central, Polk Middle, and Polk High. We're starting to see an increase at Tryon Elementary and Polk County Early College. We've had 1 impact at Saluda, but there are some families and students there that are positive as well. There have been no in-school exposures at Sunnyview, though we're aware that there are some students and families up there that are positive, and we know of at least 9 quarantined students at Sunnyview. COVID is here, and it is spreading in Polk County. Do think that another reason for the emergency meeting is this really disrupts our learning for students when they're out of school and quarantined, or we can't run school because of staffing issues. That creates a negative environment for students. It also creates an operations burden on our district. I can tell you we parked a bus today because we have illness with our drivers, and all of our sub-drivers are out. We have quarantine bus drivers. So at some point, you don't have a licensed driver to drive the bus, you can't run the bus. And so kids are stuck at home if they can't get there. We definitely have also encountered a number of students coming to school sick, and they turn out to be positive. I realize some parents may not know their kids are sick. I know that some desperately need to go to work, and I've heard that from a parent before. I don't know what else to do with my kid. I got to go to work. But we also have heard people say, it's not a big deal. It's not, my kid's not that sick. I'm going to send them on. And so we are seeing that impact on our schools. There seems to be very little interest in mitigation efforts outside of schools in our community, and that means that spread will continue and will continue to come from the outside. Again, that staffing impact is significant. We've seen shortages in every department: food service, bus drivers, school health staff, teachers, administrative people. This impacts our operations and our ability to safely and effectively function as a school system. Now, with the number and pace of cases we are seeing, it is difficult to investigate and contact trace, and that carries an operational burden in manpower and communication. Some days, folks, that's all we have time to do. It involves district staff, principals, nurses, and a lot of phone calls and conversations. If we continue in the current manner, we'll be sending more and more kids home, and we will feel an ongoing impact with our staffing. Given the current guidelines that are given to us by the state health department, and then the local health department orders those quarantines for us, given those current guidelines, if the source of COVID and the close contact are both properly masked, it's likely only that positive student's going to go home. And so the quarantined close contact moves to within 3 feet. In most of our schools, we have kids spaced out 3 feet at least. And so again, we would be talking about, if we have a face covering requirement, that would send the sick kid home. It would leave the kids who are not necessarily sick in school and not quarantined. It would greatly reduce the number of students being quarantined. We do believe that that would be a significant reduction. We would estimate this would cut the number of students and staff being quarantined by 4 or 5 times, 70 or 80 kids total versus the 550 that I just mentioned. You are aware, board, that we've received guidance from DHHS in North Carolina, our local health officials, and we've had letters from Governor Cooper, NCDHHS, and our county medical director and local health professionals and practitioners and health director. I will reiterate that we are not medical professionals, and we've always relied on and followed the guidance issued by authoritative sources like DHHS and the local health department, especially when dealing with communicable diseases. And I would certainly not advise the Board of Education to go against quarantine orders from the state or local health department. We have received calls from parents who are clear about the impact of quarantining students on their work schedules and their lives, as it is a burden, and many have asked that we require face coverings so that their kids, if well, can remain in school. Obviously, we'll need compliance and cooperation if we're to keep schools safe and open. And I do want to point out that staff were successful doing this last year. We had well over 90% of our students in school with face coverings without major issues. I also want to address the fact that one side's not losing, one side's not winning. None of us are winning. When kids are out of school for whatever reason, nobody's winning. And if we're going to go by these rules, if these are the rules we have to go by, then I see only one lever in our control that will keep students in school, and that is the requirement of face coverings for staff and students. I believe we can all agree that having kids in school is the best option. We cannot operate effectively in the current context that we're in. And we have learned and heard repeatedly that remote does not work well for students, teachers, or families. Again, the goal is to keep them in school. With the level of quarantining we're having, this board wanted to make sure that teachers and parents did not have to endure remote learning, yet we find ourselves right back at the same place again, having to give work out to quarantine kids, often those who don't have internet or can't find another way to access school. I will say at the end of it, nobody wants kids in masks. We don't want them in masks. We don't want to be in masks. But I see no other way, given the rules that we have to operate under, that we can keep the majority of kids in school and move forward in terms of having our schools open. We have to have those kids in school if we're going to educate them.
Even if it makes our kids.
Ma'am, I'm sorry, there's no public comment.
We've already decided on this.
Exactly.
Folks, if you continue to make public comments, you'll be asked to leave. The recommendation that I would offer you at this point, from my vantage point as superintendent, we have exhausted all other means of keeping kids in school. My recommendation is to temporarily require face coverings for students and staff. This would be effective indoors at Polk Schools buildings for all students, staff, and visitors during the instructional day or in instructional settings. I want to stress that this would be a temporary requirement. The board will be updated weekly, and they are required by law to revisit this issue monthly and take a vote on whether to require face coverings or not. There will be no masks while eating, drinking, or engaged in any type of strenuous activity. As we did last year, we do encourage frequent mask breaks, learning outdoors, and other opportunities so that students would not have to have face coverings on. We will honor exemptions for medical, psychological, and developmental barriers. Those are mentioned by the state. We'll have a form online, and we can give those out at school as well for those who want to seek an exception to the requirement for appropriate reasons. We hope students and families will not leave our schools, but we also know people feel very strongly about this. We'll help however we can in terms of virtual academy options or talking about other ways that we can assist you. The temporary mandate will not stop spread in our community. Hopefully it will help with the spread of the virus, but exposures in school will likely continue, and moving to this will keep a much larger number of students in school. I do want to say that regardless of people's objections or positions, our schools are not the venue for public disagreements, and we hope our community will use the proper channels to express their concerns. We cannot allow schools to be disrupted or students and staff to be negatively impacted. There will also be some lag in the quarantine rebound, as we still have cases that will have to be investigated with look-back periods before the requirement would be in effect. Other districts have seen those reductions a week or so into the change and have greatly reduced their quarantining. There is a resolution outlining my recommendations for your consideration, and I'll read that at this time. Polk County Board of Education, emergency meeting, September 7th, 2021, resolution addressing COVID-19 healthcare protocols. That whereas this board previously voted to make masks optional for students and staff at a specially called meeting on August 2nd, 2021. And whereas since the meeting, the board has received and monitored information from the Office of Polk County Health and Human Services as to the virulent spread of COVID-19 infections due primarily to the very contagious and fast-moving Delta variant. Whereas the board has attempted to operate our schools without mandatory face coverings for students and staff while otherwise following the NC Strong Schools Healthcare Toolkit. Whereas despite the best efforts of school personnel, there are rapidly escalating numbers of students and staff who are testing positive for the virus or exhibiting symptoms of the virus, requiring an overwhelming number of more than 550 quarantines of students and staff in the 2 weeks of school and the temporary closing of 3 school sites. Whereas the board feels that our schools cannot continue to effectively operate and educate children in accordance with our mission unless all possible efforts are made to contain the further spread of COVID in our schools, reduce the number of students and staff quarantined as a result of exposure, and keep students in school. Therefore, in order to keep our students and staff, their families and community members safe, and to continue to provide effective learning educational opportunities available for our students by keeping them in school, the Board of Education for Polk County, North Carolina does hereby adopt the following COVID-19 safety protocols as recommended by Superintendent Aaron Green, based on the current healthcare data and recommendations from North Carolina Health and Human Services and Polk County Health and Human Services. Number 1, the proper wearing of face covering shall be required for all students, staff, and visitors inside Polk County Schools building during the instructional day and in instructional settings. The requirement will be temporary, with administration providing weekly updates on cases and impacts. And it's noted that the board is required to revisit and approve this decision on at least a monthly basis. Administration shall develop a process to determine individual exceptions due to medical, psychological, or developmental circumstances as they may exist. Masks will not be required outdoors. In accordance with the toolkit and as practiced last year, frequent mask breaks will be encouraged as are opportunities for students to learn and recess outdoors. Masks will not have to be worn while students and staff are eating or drinking or when involved in strenuous activity. And this resolution would be effective upon the date and time of its approval. It says approved and adopted. This day would be the date, and that is the resolution. Mr. Chair, I would turn it back over to you for board discussion.
Any comments?
Well, one is, I would like to make a comment. I want us to everybody to know that we want children in school. That's our priority. We want children in school. But we cannot look at the numbers compared to last year. The reason why I say that is last year, Governor Cooper made a mandate that everybody in the county wear masks. That was at grocery stores, at sporting events, at schools, etc. Last year, we had school remote, we had virtual, and some in school, we had the high school, the middle school, which was on 4 days with cleaning in between the school on Wednesday. We had our pre-K that was at school every day, 5 days a week with no mask on. And we had our kindergarten through 5th grade in school 5 days a week. Last year, we required everybody to wear masks, and we did not start athletic events or begin any events at the beginning of the school year. So we cannot compare those people with what we have now because it's a totally different setting. This year, the governor has removed the executive order on July the 30th for the North Carolina. The toolkit dated July the 21st, 2021 that went into effect July the 30th was recommended but not mandated. Schools started with a remote learning and started with no remote learning and with sports beginning on the first of the year. One school that does not have many people wearing masks have not had COVID in their schools that we see of at this date. We've got a number of high school and middle school and elementary school children that have been positive for COVID. However, I would like to see a breakdown of each grade to see where these are affecting each grade and to see how it's impacting our students. We don't have that data to this date to say it's all 5th graders or it's all 4th graders or it's 10th graders or seniors. And I would like to see that prior to us making masks be forced on our children at this time. I would like to also see us to have only the sick children be sent home and not the whole class quarantine. In the school toolkit, it does say a recommendation for us to follow by the health guidelines. It does not say it's mandatory that we follow those guidelines. I know Mr. Green has suggested that we follow those guidelines because we go by the health guidelines for our students. However, I feel like that is causing more and more students to be out of school for quarantine than what it would be if we just sent the people home sick. As we have seen in these past couple of weeks, we've saw that the vaccination does not necessarily work because we've had people who have have COVID with the vaccination. We have seen people with masks that have had COVID. We have seen people without masks that have COVID. With not having the Polk County masked up outside of the school, it's not going to be beneficial because as soon as they get out of school, these children will be outside with no masks on, just like they would be if they were in school. So it's not going to make a big impact on us because the germs are going to still be there, just like with the flu, influenza, all that, the germs are there. And we have to, are we with the next 3 variants that they say are coming out, are we on every time the variants come out and say, we're going to close school or we're going to mask these people up? So I have concerns about that. I have concerns that this will continue to go on, and we'll never get over to where our children can see face-to-face teachers, hear their rumbling of their tongue when they say the R's and the S's for our pre-K, and even for kindergarten students. So at this time, I would say, I do not want to see masks on the children due to the fact we don't have the data that we need at this time. We need to see the data from our school personnel to say, how is it affecting which children in each grade, how many in those grades? Because we've got over 2,300 students in Polk County. Right now, we have 90 that has been affected with COVID. Even though we quarantined 550, that does not mean all 550 has got COVID. That means that they were quarantined because somebody in their class brought COVID in and they had to go home. Maybe a masked person or a vaccinated person got to stay and an unmasked had to go home.
No, it'd been nice though to have discussion, you know, being a board of 7 prior, instead of just, you know, publicly just now making it known a lot of your feelings, but I'm for mask. I think we have no choice. I'd like to keep as many kids in school as possible.
Ms. Bell,
I've said from the beginning, I think we should be following state guidelines, and I have not changed my perspective on that.
Ms. Edwards, Ms. Gibbs, I'm sorry.
I really feel like we have been put in an impossible situation. I don't think that this should fall on us. I feel like the health department is, you know, we're following them on the quarantines, and I feel like that this is a decision that they should be making. I don't think that a board of education across the state, across the board, period, should be making this decision. I mean, it's impossible. It's absolutely impossible. We're not health experts. This isn't what a board of education should be voting on. This is not our jurisdiction. I realize now that, you know, it has fallen in our lap, but it is completely unfair. I mean, to vote as a parent, how you would want your child to be done, that's all we can do. We're not immunologists. We're not doctors. There's too much emotion in it. There's too much, it's completely unfair. I want to see kids in school, and I feel like when we put these masks on the kids, right or wrong, parents are going to pull their kids. Are we keeping them in school? If we're putting masks on them and they're going to be pulled from school, then we're not keeping them in school. You know, we've got 400 kids quarantined right now, but they're coming back. We put masks on school, and then we stand to lose 200, 250. Maybe. I think you said our numbers are up 300. I don't want to see them go back down. I want these kids in school, and I want them in school.
Ms. Allen,
As a board, I believe we are mandated to provide a sound and basic education for all children in a safe environment. We know that students need to be in the classroom in front of the teacher. We can't educate them if they're quarantined or if the schools are closed. And I don't think that's what we're about. In no way going to usurp the rights of parents to make decisions for their children or restrict anyone's freedom. I just want to keep children in the classroom in as safe an environment as possible. And I believe at this time, the way to do that is to make masks mandatory temporarily under the guidelines that have been set out in the resolution that has been presented. And I just feel like that is the right decision at this time.
Mr. Ashworth.
I don't know that I can really offer a lot more than what Mr. Green has had to say. I do not disagree with Ms. Gibbs or Ms. Jackson. or Miss Allen for that matter. I just think we're all as a board in an absolutely impossible position. We tried to go and put our kids back remote. I had 2 conversations with teachers today that said there would be a mass exodus of teachers. So if we try to go remote, that's not going to work. With the current guidelines we're given, I don't think that anybody's going to recommend, our superintendent, our council, anybody's going to recommend we go against those guidelines with the repercussions that could come back on our board should something bad happen from our classrooms. So I have an accounting and finance degree. I'm not qualified to make healthcare decisions. I don't like the position we're in as a board. It's been an impossible position. But at this time, given the facts of the matter and where we sit, I don't feel like we have much choice in offering safe classroom. This morning I got up and 3 of my 4 kids are at home because schools are closed. I want them in class and they didn't have any instruction. They all told me to a T they had nothing to work on. So I want the kids in the classroom, just like Daniela said. And I feel like we're just in between a rock and a hard place right now. We don't have much choice. But to go along with this for the time being, I do want us definitely to reiterate again, if we do this as temporary and we get the mask back off the kids as quickly as we possibly can.
Can we define temporary? Like, what is our end goal? What are we looking at? What are we hoping for?
Yeah, I think that the board could be very specific about that if they wanted to be in terms of setting some type of threshold. Hey, positivity in the county goes below 10%. You don't have more than 5 cases a week. We can look at parameters for you guys to make those decisions. But at the rate we're getting right now with 6 to 8 positives a day where we're having to investigate and go do all those things, that's not sustainable. So at our peak last year when we were functioning, we maybe had 1 or 2 a day that we had to address. So I would think you'd need to at least get down, to a certain number per week that you had to deal with, community spread that was below where it is right now. I'm hopeful that, again, none of us know anything further than what we see day to day. I know the guidance has changed. That's one thing I think we've all been frustrated with, is that it changes by the hour. I will tell you that none of us predicted this Delta variant being so contagious and hitting us so hard. But the trend lines that we see out there, when you look at other states who've gone through this, they peak and then they drop back down. That usually happens within 2 to 4 weeks. So I would definitely want to make sure we get you information every week. And so that when we see a time when that positivity rate drops below a certain level and we quit having cases and exposures in school, we immediately take the face coverings and make them optional. I also think that there's an issue if we are seeing spread in our classrooms. If we're spreading in our classrooms, that's a problem. So we'll need to keep track of that as well.
Mr. Green, will we get these numbers once a week?
Yes.
At the end of each week?
At the end of each week, yeah. We'll sit down and do that. We've got a report, a dashboard we've been working on. We just have to stop in the middle and call people and answer questions about quarantines and get cussed out by the people who didn't want to be quarantined and get cussed out by the people who wanted to be quarantined more. So, as soon as we get that done, we'll do it.
Say something.
No, ma'am.
Please.
No, ma'am.
Do y'all not care about our kids?
Yep.
This is about a breathing problem.
Ma'am, if a child or anybody else has a legitimate issue, then you can find a doctor to apply for an exception, and we'll honor that exception.
Okay, that's what I'm gonna do.
Yes, ma'am. Yes, ma'am. I think that is what we want to do. We want to try to work with everybody. And that's something I hope I stated clearly earlier, that those exceptions will be recognized. So we have a form for that. It'll be linked online if we do indeed go this route, so that you can get those. You can also go to the school and pick up a copy. We'll have those available as well. So that was something very important to the board. Board, if you want to take a look at that, these are the the typical state approved forms. A lot of districts have used this, but definitely if you have a service provider, a doctor, somebody has a psychological issue, something that really keeps them maybe super high anxiety, if they can get somebody to document that other than just me and Mr. Koval talking, then we can honor those exceptions. Also want to make it clear that that's something that we'll have to do quickly and get that turned around for people who want that particular exception. Hope that addresses that part of it for the board. That was something I know that several members had asked me about prior. And then I also want to make sure that we do get together, get you the data, and then let you tell us, I want this data a different way. You said it broke down by grade levels, so I've got that written down. If you want some other way, let us know and we'll get that out to you.
Go ahead.
I want to just make sure we did mention that this has to be by governor order now, we have to vote on this once a month, right?
This is Senate Bill 654 that made it very clear that the governing body of the local public education unit has to revisit this decision every month. If nothing else, to approve it, to continue, or to say, no, we're going a different direction. So every month we'll be having this conversation. I also want you to know that just as we had an emergency meeting right now, we can do another specially called our emergency meeting as soon as those numbers go down, so that we don't have to wait till the next board meeting to make the face coverings optional. And that would be my desire and my expectation for us, is to make sure that that happens as quickly as possible.
Absolutely.
Will the parents have time how much time will they have to get this waiver for not having masks done? Will they be, because if, say this mask mandate passes tonight, will they be punished because they don't have this by tomorrow? Will they have a deadline that they have time to get this from a doctor? Because you know as good as I do, you can't just get into a doctor by calling overnight.
I agree with that. The language in the resolution is clear that it would take effect when you adopt it, but obviously I will take direction from the board if they want to make that a difference.
Because I think that we have to give parents the option to get the necessary documents to waive their child from a mask. I think that's the only way that we could do this fairly to parents that have issues that need to have their child not in a mask. We need to give them more than 1 day's notice.
I sort of agree with you. We need some type to let these parents have a few days. I don't know how, but I just feel like they need a few days. I'm gonna say this board on both sides. I'm gonna really be watching this temporary part of it. I don't want people to believe that, because nobody wins tonight. If we don't meet halfway, nobody won. The kids lose. So I want both sides to understand, as one board member, I'm gonna watch this temporary on a weekly basis. And that's just my feelings.
I feel like you nailed it right there when you said that the kids lose, because there's no one in our community that supports this. There are more masks in this room than there have been in any local business that I've been in recently. We have no community support, none whatsoever. I mean, this is a much bigger problem than just at school.
You know,
I'm not saying that COVID's not real. I believe that it's very, very real, but
you know, the one thing I'll say that like may help us rest easier with that same thought is that you know, the status that our hospitals locally and regionally are in right now it's really scary. And on a whole host of issues, the schools are typically a bellwether for the community. You know, if schools close down because of weather, you see local businesses close down. You know, you see the schools behave as the leading force within a community on all sorts of things, you know, from a community safety perspective. And so it's quite possible that if we make this difficult decision, we may see this helping our community at large. Not to mention just that we can get back to operating the business of running the schools, which is what we started with. And it sounds to me like we're in a spot where we can't function as a business right now with how much you guys are having to deal with and how much our school administrators are dealing with. So we've got to just get it back to a controllable level, and then yeah, hopefully we are back to control.
It ain't nobody got no faith in y'all.
Okay, hold up.
Please go.
We ain't going back nowhere, we just wear them all year. That's bull crap.
Yeah, would you, I mean, you had a discussion about adding some type of stated time frame for exceptions. How would you like for us to handle that from an operational perspective? Do you want us to say that students will be allowed or parents will be allowed to state an objection and give them a time frame to get that form filled out?
That sounds good to me. If we pass this tonight,
Is there a determination on the length of time?
I think if a child has a documented medical condition, an appointment within 48 hours is reasonable.
I can't get a doctor's appointment in 48 hours.
hey, hang on. We're gonna work
Right.
It's Tuesday.
I would think 7 business.
Folks, I'm gonna ask one more time, please. There's no reason to.
I'm just gonna go in and leave.
Be insulting or anything like that.
Believe me, we are doing our best. I'm sitting up here sick tonight, not knowing what to do.
I
No,
understand that.
we get
But my
it.
son was sick all last year
Okay.
because of these masks.
So you gotta, you can fill out one of these forms. Hey, listen, don't speak that no more. I don't want you to have to leave.
I'm just trying to do what's best for my son.
I understand. No more. Okay, any more comments? And I say the people's got a legit concern. Give them,
Will the schools have this documented?
help me here.
I think you're gonna have to give them a little bit of time right now, because I know where my kids are, well visits are not happening. This is not, sick cases are pretty much all that they're working into. I think you're gonna have to give them, I would say at least till Monday, possibly even more. Because
10 business days, is that 2 weeks?
You guys, this is gonna be a mess.
That's, you're asking for. a
Excuse me,
logistical-
wait a minute. The attorney cannot speak until we call on him. Is that correct, Mr. Chair?
Yes.
Okay.
Okay. Mr. Fagan, would you give your opinion about that?
That's gonna be a logistical nightmare. How do you determine what's legit without medical documentation backed it up? And if the child has an existing condition, which is what the exceptions are designed to address, not something that you go out and look for a medical reason or excuse for, would be an existing condition. Surely that can be documented within 48 hours, Ms. Bell suggested, or something.
We have existing documentation for exceptional children, for example, kids who are developmentally not able to do that. Pre-K falls under the developmental piece of that. You know, those kids are learning how to wear face coverings and things. So those kids would fall into that developmental exception at times. We have documentation on that as well. I work at the pleasure of the board. So I think that if you go down the road of too many exceptions, then you just might as well not have a policy and we just go on what we're doing. You can shut school down for 4 weeks, which I don't think is a good idea until we get past this wave. Again, from an operations perspective, when I sit in my chair and the staff here at Stearns and all of our school staff members out there in our schools, we are working to keep our schools open. And when we don't have staff in place, we don't have bus drivers, we don't have food service workers, we don't have school healthcare staff, we can't safely operate school. So again, my goal is not to mask up kids because we love masking up kids. It's not to try to take anybody's freedoms away. Our goal is to keep schools open and to keep kids in school. And under the guidelines that are issued to us by the state and local health department, which again, I do not advise the board to go against the health department quarantine orders. But that's what you would have to do to change things right now. So the only thing under our control or my control is to use the face covering so that the sick kids go home, the kids who are well don't have to go home. They stay in school.
Would it be reasonable to suggest that we go ahead and adopt the resolution and just have an agreement where we work with these families as best as possible to get this documentation on
On a
file?
case-by-case basis?
Yes.
I agree with that, Mike. I think we'd be handing our school
Like the
administration that.
principals at each school. Work with that.
We're on the website.
Remember,
I'm just asking where the form's at, sir.
It's online at
Thank you.
publicschools.org.
Thank you, thank you.
any more
It
comments?
will be, come on. It depends. If they don't pass it, it won't be.
I would like to make a motion that we do not pass the resolution tonight for putting masks on our children.
And a motion to have a second.
I'll second.
Any more comments? All in favor, raise your hand. Opposed? Do I have another motion?
I would like to recommend that we adopt the superintendent resolution with the added exception that we just mentioned.
They'll work on a case-by-case basis to deal with requested exceptions
Time frame.
as quickly as we can get it done.
A second.
Any more comment? All in favor, raise your hand. Here's 5-2. I just urge everybody to work together. Let's meet halfway. I promise you we'll get this done. And that's all I need to say.
Can I make a motion that we move our next meeting back? So we can revisit this.
Move it to what date?
I don't think that 1 week, because we'll have to vote on it again. I don't think 1 week is.
We're not gonna vote on it that quick. anyway.
No.
So are you suggesting the 20th, 21st, somewhere along there?
I think you're actually safe under the new statute if you, since you considered it this month, that you would consider it again in your regular October meeting.
Mr. Cagle, again, attorney's not supposed to speak until we ask him to speak.
I'm just speaking.
Well, am I correct in the rules on that? Will you clarify that for me, Mr. Cagle?
Yes, ma'am, I think so.
Okay, thank you, sir.
Then did you make a motion that we move our meeting?
If we're gonna vote on it, I would like to move it out a week.
I don't think we have to vote on it again that quick, but we do want to look at this every week and see about whether or not.
I think Danielle's point is,
That would give us 2 weeks.
it's just a
and then
week,
school
you know,
2
with the
weeks.
lag time, once you put the face coverings on, you're not gonna see a quarantine impact, because our look backs will still be in those weeks. So you really won't see an impact for a couple of weeks, and then a couple of weeks also, hopefully, we'll start to see that go down.
And I'm definitely supporting delaying just to get it more time to work.
Okay, I got a motion to have a second.
Well, it depends on the date, and I think we can see everybody.
Can everybody be here on the 20th?
I'll vote virtually.
I'm sorry.
I can join virtually.
Yeah, I'm sorry.
I'll join virtually if I'm not in town.
Can we
Okay.
do the 21st?
That's a Tuesday.
No,
I'm out of town.
Yeah, I can do
We do the 27th? My husband's having surgery on the 20th.
It's 27th on
It's Monday.
Okay, I got a motion for to move our meeting to 27th.
Mr. Fagan, is it necessary for us to do it from, to stay in line with the statute?
It's in accordance with the statute, you consider it every month. You have now considered it in the month of September. You do not have to consider it again until the month of October. And it would be logical for you to take it up as a regular agenda item at your October regular meeting. It's not going to be much longer than the other dates that were suggested.
Again, I'll say that, we'll be giving you weekly updates. At any point, this board can call a special meeting or emergency meeting to address changing conditions.
Can you live with that, Ms. Gibbs?
So we're gonna leave it then for next week.
regular meeting will be Monday, Monday, September 13th.
Right.
So no change there. Mr. Chair, there's no more business for the board. Thank you, folks.